Those living with diabetes have a lot to manage to keep their blood sugar levels in check, but something that they may not be in front of their minds is how to protect themselves from foot complications caused by diabetes. Dr. Kumar is here to talk a little bit more about that. Good morning, Dr. Kumar.
Good morning.
I actually knew somebody who had diabetes who had to have his foot amputated because of this.
Somebody very close to me had to have that happen, my brother. And yeah, it happens more commonly than people think. And you're right, you know, diabetes is a lifelong disease, and there's a lot to worry about with diabetes. And we're going to put one thing on their list that they might not think of, but it's critically important. And as you said, it's their feet. You know, people that have long-standing diabetes, they get nerve damage. And when you get nerve damage, you know, the feeling in your feet might not be very strong. And it might be thought of as a blessing in disguise where you don't feel pain. But pain is our friend in some ways. It tells us that you've been injured. And so neuropathy can affect the toes and the feet. And when a diabetic injures themselves, like bumps it against the doorknob or the doorstop, or it is exposed to a lot of heat, you can get injury at that toe and not be aware of it. And, you know, the blood flow, as you get diabetes and you have long-standing diabetes, your vascular system, your blood flow is also affected. So you don't really have the great blood flow that helps injuries heal. So you combine those factors, and what can happen is you can get an infection in the toes that could lead to greater infection and eventually gangrene. And if you have gangrene, like you said, that's when you have to have that toe, hopefully not, but amputated. And sometimes that amputation comes higher on the foot, or sometimes below the knee.
Even higher and higher.
Yes, they do go higher and higher, and I have first-hand experience with that. And so diabetic foot complications can actually lead to very drastic results of below-the-knee amputations. And that's why it's really important for diabetics to pay attention to their feet.
So what do we do?
So diabetics need to understand, like, the foot problem is paramount. You need to really be aware of your foot. So first, you got to clean your feet every day. You got to take the effort to go down there and between the toes to make sure you clean it all out and inspect them. Just take a look at your toes and feet and make sure there's not any open wounds, there's not any infections between the toes, particularly athlete's foot. And then know when to go see the doctor. You know, if you do have these abrasions, to go see the doctor. And if you have a callus or something like that, not to remove it yourself. Sometimes that's what starts it. You have a little callus and you just want to kind of take care of it yourself.
And because you can't feel it, it's a little easier to do that.
It is, that's right. It's not going to hurt. It's going to be quite easy to take, you know, a knife or something, but you might get that callus infected. And so if you take the callus off, it has to be properly sanitized so that it doesn't get infected, and your healthcare professional, your primary care doctor, a podiatrist, and you know, diabetic foot clinics around, and they're very adept at doing that. And so these are the things that diabetics need to be aware of, and also just to understand that they might not have these feelings, and so they need to be aware of their environment and make sure they don't bump into things. They need to wear very good shoes, you know, that are the adequate size. You don't want to wear shoes that are too tight, that cut off the circulation. And so having important good solid shoes, inspecting the feet every day, making sure you don't, if you do self-foot care, that you do it properly and you're instructed how to do it. Be sure to trim those nails, because the nails are a source of infection as well. So to keep the nails short, you reduce the chance of infection. You know, not to go out into the world barefoot. That's just inviting trouble. Even in your own home, you know, you can bonk it against these doorstops that I've said about. You know, wearing good household slippers is also a wise idea. You know, and the CDC on the website, cdc.gov, you go diabetic foot. You know, they have a list of healthy tips that we just presented on the CG here today. So diabetics can find more information about that on that website.
All right, something to think about. Dr. Kumar, thank you as always.
Thank you.
And if you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. Don't forget to like Dr. Kumar on Facebook, Ask Dr. Kumar, or follow him on Twitter at NBCD Kumar. We'll be right back.